Hi everybody, today I'll be talking about cognitive behavioral therapy. Cognitive behavioral therapy can be defined as a way of replacing a negative thought, feeling or emotions with a more positive thoughts or more positive thoughts, feelings or emotions. So usually CBT is used in our day-to-day practice. What are the techniques of CBT? First of all, we have the cognitive restructuring. In cognitive restructuring is a kind of cognitive restructuring is a kind of replacing negative thoughts, behaviors or emotions with a more positive ones. Is a kind of displacing them, like when a patient or when a client start to think about negatively, they try. What happens is that once the patient perceives that negative thoughts, the patient stops it and tries to put more positive thinking, more positive thoughts rather than thinking negatively. Also, we have techniques of CBTs include behavioral logs. Sometimes patients are being told to log in the negative behaviors or the negative thoughts. So in such by so doing, these thoughts are being identified and these thoughts are being worked on. Implementing CBT in a clinical practice, one of the ways to implement it is through psychoeducation. Clients should be educated that whatever thoughts or whatever thinking or whatever thoughts they have has directly influenced their behavior. If a patient is being exposed to negative thoughts all the time, that means the behavior obviously is going to be a negative behavior. So they should be educated, they should be aware that their thoughts is directly related to their behavior. However they think is whatever they are going to, that's how they are going to behave. Talking about DBT right now, so DBT was originally developed for by personality disorder. It was originally developed for personality disorder, but however, it can be used for a lot of mental health disorders like post-traumatic stress disorders, depression, eating disorders, substance disorders. CBT in clinical encounters. Obviously, CBT is used on a day-to-day basis on clinical encounters, especially during this psychotherapy session. For example, when clients come to us talking negative things about themselves, telling us that they are worthless, things like that, we try to stop them from thinking in a negative way. We try to tell them to suppress those negative thoughts, refrain from thinking negatively about themselves, and focus more on the positive things. This is actually CBT in practice. So CBT is usually used on a day-to-day activity. I'm just gonna explain about a CBT technique we used in one of the clinical and encounters. So this client came because she has this social anxiety, social phobia. She always finds it difficult to talk in a group session or in a discussion or where people are in groups or make her suggestions. The problem is that she always feel she doesn't want to be judged, or she feels like whenever she makes mistakes, people are gonna judge her. So what we actually did for this girl is that, so we try to let her know that whenever she is having a public speaking, or whenever she is in a group, she shouldn't be scared that she will be judged. No, whenever she has that thought, or that thought comes in her that, oh, I please don't talk, that you're gonna make mistake. No, she should tell herself that other people make mistakes doesn't hurt, it doesn't kill. Probably people might not even notice that she made mistakes. So these are one of the ways we use CBT in our clinical practice, in our clinical encounter. Thank you so much.